Hi, everyone. I am a private practice pediatric ophthalmologist, and I teach medical students and pediatric residents. And I'm here just to give you a feel for why I use CureSight. So, CureSight is a binocular treatment. It's cleared by the FDA for 4 to 9-year-olds, and it's indicated for the improvement of amblyopia and stereopsis. It's eye tracking based real-time image processing according to the gaze position. It creates a central digital scotoma in the sound eye, which follows the child wherever they're fixating on the computer screen. The periphery is clear in both eyes, which assists in stereopsis. And this is live stream internet. It's on Wi-Fi, it's in the home. Kid can be watching YouTube, Netflix, soccer videos. I stay out of the messy Ronaldo controversy. They can be doing video homework from their school. They can even be doing religious studies. It's whatever the parents are comfortable with. And so I don't have the older kids coming in telling me that they're bored with the content. The monitoring center is huge in terms of how this plays out because it is a digital processing and eye tracking. The device knows what the child's doing. So it's not just that the device is on, but the child needs to be looking at the device. The child needs to have the dioptric glasses on. The child can't be fiddling with the glasses because the device beeps at the child if they're not complying. They can't be watching the television. When we're initiating therapy, I tell the child, we're going to be watching you, and they don't necessarily believe me yet, but they find that out when they come back for the follow-ups if there's lack of compliance. And some of the kids, they just rise to the challenge and they say, we'll see, doc. So if compliance is not happening, you're doing your work, you're doing whatever you're doing. The center is calling the families, and they're instituting a discussion where they're saying, hey, this is what's happening. And when the parents come back and follow up, they're like, yeah, we got called a bunch of times by the center until we started doing better. And if that's not happening, if either they can't reach the family or they just are not getting better success, they call us. We can touch base with the family, find out what's going on, not to mention that we have 24/7 access to any of these kids at any time and see what they're doing at home. And the way it plays out in my clinic is my optometrist does a monthly check, and if we document if there's good compliance or not. So I haven't always looked at it at a good complying child, but it's in my EMR. So when they come back for the follow-up, I've got the report from Dr. Bennett that tells me if we've been doing well or not. So quickly, so this is Dr. Wignansky-Japsky's first study, the 2022 study, which was presented to us at AAPOS New York City last year. But briefly, for those of you who may not have seen it, it was a randomized 103-patient study, 4 to 9 years of age, amblyopia of 20/30 to 2100, interocular difference of 2 lines or more, aniso at least diopter, and no strab, no significant strab. 51 kids in the CureSight group, 52 kids in the patch group, and it was just a standard hour and a half, 5 days a week, 14 weeks for the CureSight group versus 2 hours a day, 7 days a week, patching for 16 weeks for the patch group. And that does work out to a difference in work because the CureSight kids are doing 120 hours, the patch kids are doing 224 hours over that 16 weeks. The baseline vision in both these groups was 0.37 logmar, and what you see is the improvement in vision in that top right graph. So as the weeks were progressing, both patch and CureSight did equally well for the first 12 weeks, but patching then plateaus, and the CureSight continues to improve, which suggests that that trend will continue. And initial vision 20/50 in both groups. The CureSight group at 16 weeks was 20/25, the patch group was 20/30. So that works out to 79% of the CureSight kids getting at least 2 lines of improvement versus 61 on the patch. Adherence with the monitoring center in the CureSight group was 93%. We, of course, don't have patch data, and 95% of the patients' parents were happy and would recommend CureSight to another family. So then this is just real-life data from the clinic. I started using CureSight January 2023. And it really picked up volume over the year. This is the classic kid you've been following for a couple years. So this is a 6-year-old you've known since 4, high hyperopic astigmatism, a little bit of ESO, high AC to A ratio, initially presented me with 20/80 vision, and I could get this kid to 20/40 with patching, atropine, glasses. We started with patching, they became resistant. We started atrophy, and that's not ideal. You got to take the bifocal out, no stereopsis. And so in June, we did switch to CureSight. I could put the bifocal back in, stop the atropine, and 4 months later, this child's 20/20. Now, the theme you're about to hear from me is now what do we do? And I've still been working that out until this one-year data, because frequently the family doesn't want to stop the device because you finally look like you know what you're doing. The kid doesn't want to stop the the device. If you've got 4 or 5 kids in the family, 2 computers, they got their own setup now. And they've got guaranteed screen time too. So I get resistance from both of these situations. So you'll find that many of these kids till now have been getting about 4.5 hours maintenance on the CureSight. But look what happens. In February 2020, both eyes, I actually did surgery on the ET. They come back in March 2020, both eyes, straight eyes, and I've got a very happy mom. Now, this is a very different scenario. This is the 9-year-old boy with the attitude. So this is the kid who comes in with no glasses, 2,300 uncorrected. Dad's on Prevacid, and the kid's not using his glasses, not using his patching, not using etchment from a very good optometrist near town. And he says, you got to do something else. So we did reinstitute glasses, of course. We started CureSight, and 3 months later, this kid is 20/30. Dad's impressed, but this is the same kid. So summer hits, summer camps, summer vacations, there's no mystery here. You look at the compliance, you see that they're not doing anything. So this is when the kid comes back August, September, I hold up my iPad and I say, I know what you did last summer. But Dad's on board, and we get the kid back to 20/30 plus. But look at this, February 2020, both eyes. So now, and it's also a different conversation. These parents are on board with you now, because this dad says to me, well, look, he's still only wearing his glasses 8% of the time, but I got you, doc. If it's a bad week, I give him a drop of atropine. And so we are going to taper now, and we'll see how he goes, but this one impressed me. This next child you've probably seen on the videos from NovaSight. I've been over to the booth, but this is Ella. And I had met her when she was 4. She was 20/80 uncorrected. We could get her to 20/50 with glasses and patching, but we stalemated at 20/30. We had plateaued, and this is going on for almost 2 years. Dad's an engineer. He's sitting in my lane at the end of March 2023 saying, what are you going to do now, doc? And I said, funny you should ask. Just gotten back from the city. We started CureSight, and they're actually 20/20 4 months later. Now, this father was not giving up the CureSight. And he's been very hesitant to stop. I've had him at 4.5 hours. She's maintained 20/20 vision. But now we've got this 1-year data, so I have gotten Dad to stop the CureSight. But he's still uncomfortable given all the drama we had in the past, so he's doing maintenance patching until they come back. And just to say that this process is continuing in my clinic, this is a newer case, 4-year-old, aniso, amblyope, and we had gotten him just with glasses at 20/60. I enrolled him in the CureSight early February, and 6 weeks later, he's up to 20/30. And of course, he's still being treated. So I will conclude by saying that up till now, I've been working out how I do this. This 1-year data, first of all, it says to the parents what we know, that the device works, but it also says that the gains are not transient. And I think both the clinician and the parents know what to do when we hit 20/20. I expect to see improvement. I think most of us expect to see improvements with the device in 3 to 4 months. I expect to reach treatment goal by 6 months. And up till now, as you can see, there's been lack of clarity what to do. But at that point, at the moment, if you ask me, I would say, well, let's do 2 months of 4.5 hours a week, and then hopefully we can move on to returning the device. I thank you for your attention.